Hi all, this is Dr. Kingston, and in this video I'll be going over the extraocular muscles. The objectives for this video are to identify the extraocular muscles and their attachments, and then describe their actions and innervations. The extraocular muscles are a group of muscles that insert on the sclera of the eye and function to change pupil orientation by rotating the eye. One major exception here is the levator palpebrae superioris, or this muscle right up here. There we go. And that attaches to and is used to lift up the upper eyelid. All right, with one exception, all of these muscles originate posteriorly in the orbit. That exception is the inferior oblique muscle, this guy right here, which you can see originating from the anterior maxilla. For the rest of these, we're going to look up in the posterior orbit, and I want to draw your attention specifically to this nerve here, the optic nerve. As it enters into the orbit, it is surrounded by a thick fibrous ring called the common annular tendon. It's common because multiple muscles are going to originate from it, and annular because it forms a circle. This is going to be the origin point for the rectus muscles, so superior rectus, lateral rectus, inferior rectus, and medial rectus. Rectus means straight, so the names of these muscles are telling us how they approach the eye. Okay, so that inferior oblique muscle that we saw here, it's coming at the eye from an angle or obliquely, whereas these are coming straight on. All right, so if you find yourself in lab or on a practical struggling with figuring out which extraocular muscle you're looking at, take a look at the direction it's traveling to meet the eye. All right, so we have our rectus muscles originating from this annular tendon, but posterior to that, so back here, up from the sphenix, the sphenoid bone is where the superior oblique muscle is going to originate, as well as that levator palpebrae superioris. So the superior oblique muscle is going to originate from the sphenoid, and it's going to run anteriorly along the medial wall until it meets this little fascial sling called the trochlea. Trochlea means spool, so it's a spool-shaped piece of connective tissue, basically. And then it is going to take that superior oblique muscle and kind of yank it around so that it also approaches the eyeball at an angle, much like the inferior oblique. All right, so finding your way around the orbit can be a little bit tricky at first. All right, we can label superior rectus and inferior rectus based on their position, okay? Same with the superior oblique and inferior oblique. But that leaves us a question, which is medial rectus, which is lateral rectus? And in these examples, I fully admit that I have taken an extra step into evenness by not labeling whether we're looking at a right eye or a left eye. But there are a few ways that we can figure that out. All right, so number one, this chunky thing up here in the corner of the orbit, and see that over here as well, looks pretty glandular to me, right? And we know that there's a pretty big gland that sits in the superolateral corner of the orbit, yeah? So we can feel pretty confident in calling this the lacrimal gland. And if that's the lacrimal gland, then this muscle sitting directly inferior to it is going to be the lateral rectus. Okay? And if that's the lateral rectus, that's the medial rectus. All right, so are we looking at a right or a left orbit? Well, if this is medial and this is lateral, and we remember to put ourselves in the patient's position, we can say that this is a left orbit. So now that we've got a little bit of a handle on finding our way around these extraocular muscles, I want to switch gears and talk a little bit about the orbit itself and how it's going to influence the actions of these muscles. Now, if you take nothing else away from this, what I want you to understand here is that the whole of the orbit is not oriented anteriorly, right? It's oriented kind of anterolaterally this way. The medial wall here is oriented in the sagittal plane, but because the orbit is cone-shaped, the lateral wall is oriented at about a 45-degree angle away from that. Now, despite this, the pupil is still oriented in the sagittal plane when none of these muscles are firing. So we're going to call this neutral position. That means that there is a mismatch in the orientation of the orbit and the orientation of the pupil. Now, this is going to affect those extraocular muscles in a couple of ways. So number one is that these muscles insert into the sclera in line with the orbital rim, so this orbital rim here, rather than in line with the pupil. That means that they're all kind of inserting at different distances relative to the pupil. So if you look here, you can see how much closer that medial rectus inserts than the lateral rectus. The second thing that happens here is that the muscles attach at different angles relative to that pupil direction. So take a look here at superior rectus, and put a line on there, and we see that it's about 23 degrees from the sagittal plane. The superior oblique muscle is at an even more extreme angle. So why am I telling you all of this? Please believe me that when I say I'm not going to be putting any math on the exam, we're not going to have any kinesiology. I'm showing you this to illustrate exactly how many different ways these muscles can interact with the pupil and orientation of the eye. And most importantly, I'm showing you this to drive home the point that making even a simple movement of that pupil can get pretty complicated. So let's break things down as simply as we can. We're going to start by naming the four primary eye movements. We have elevation, depression, adduction, and abduction. We use these to describe all sorts of intermediate directions as well. So we can elevate and abduct, depress and adduct, and so forth. So these are probably familiar to you by now. The other movements of the eye that you're probably less familiar with are going to be rotational movements, or movements that spin the eye around the pupil. Rotation inward is intorsion, and rotation outward is extorsion. These rotational movements happen because of the angle that some of those extraocular muscles grab the sclera at. Now, the upshot of all this is that your extraocular muscles very rarely fire in isolation or one at a time in daily life. You are almost always firing two or more to prevent your eye from spinning, which would make you feel sick to your stomach. So that said, in this course, your job is going to be to learn the actions of these muscles as if they were firing in isolation. We want you to understand what these muscles could do if they fired on their own. We're going to save talking about how they're actually used for the kinesiology department here. All right, so with that out of the way, let's talk about how these muscles move the eye around. It would be really nice if they all just did what their name suggests they do. So superior rectus should elevate, inferior rectus should depress, but it's not quite that easy. So going back to all of these funky angles that these muscles grab the eye at, that means that most of these extraocular muscles will not do one specific action. They will do, they have an action that produces usually two or more of those primary movements that we saw in the previous slide here. Okay, so if we're talking about superior rectus, it is not only going to elevate the eye, it is also going to adduct it and intort it. All right, we end up with only two muscles that have a single action, and those are our medial and lateral rectus muscles. All right, so let's use those medial and lateral rectus muscles to start putting together an action chart that will show the action that each of these muscles could produce. All right, so we have our pure abductor here in lateral rectus and our pure adductor here in medial rectus. Our other extraocular muscles are going to fall into the category of either adducting plus elevation or depression, or abducting plus either elevation or depression. And we're going to use the yellow and blue backgrounds here to kind of indicate which they do as we build up this chart. So for now, let's start by laying out some guidelines as to what makes a muscle adduct or abduct. Adductors will insert on the medial part of the sclera, or the medial aspect of the eye. And they're going to rotate the eye around the y-axis. So y-axis, remember, is straight up and down. So rotating around that means looking side to side. Abductors, on the other hand, will insert on the lateral sclera, and they will rotate the eye laterally around the y-axis. Elevators are muscles that rotate the pupil superiorly around the x-axis. You have two of them. You have the superior rectus, which also adducts and intorts, and the inferior oblique, which will also abduct and extort. And yes, you did hear me right here. The inferior oblique muscle elevates the pupil. The reason for this has to do with where these muscles insert on the eye relative to that x-axis. So let's put, here's our x-axis here along this line, and let's take a look. So superior rectus inserts anterior to that x-axis. Therefore, when it shortens up while it fires, it's going to pull back this way, and it's going to end up elevating the pupil that way. The inferior oblique, I'm going to pull up a different color here, inserts down here posterior to that x-axis. When it fires, it's going to pull this insertion site this way. And as it does that, it's going to end up rotating the pupil superiorly as well. Depressors also rotate the eye around the x-axis, but they do so inferiorly. So these muscles are the inferior rectus, which will also adduct and extort, and the superior oblique muscle, which will also abduct and intort. The inferior rectus, like the superior rectus, is going to grab the eye anteriorly, okay, down here. So it pulls back this way, and that is going to force the pupil to rotate inferiorly. And then just like inferior oblique, the superior oblique muscle is going to grab the eye posteriorly, which we can see there. It will pull this way, and that will bring this part of the eye that way and end up rotating the pupil down like so. So if we put this all together, we end up with a nice chart showing the position that each individual muscle would pull the eye into if it fired all by itself. In addition, we can also suss out a couple of easy ways to remember these for studying. All right, so first rule here is that the rectus muscles move the pupil in the way that their name says. Okay, so superior rectus is going to elevate the pupil, inferior will depress it. The oblique muscles are going to do the exact opposite. So inferior oblique will elevate, superior oblique will depress. The oblique muscles are going to abduct in addition to elevating or depressing. And the rectus muscles are going to adduct in addition to elevating or depressing. And finally, one last rule here, muscles that have superior in their name. So we've got superior rectus, superior oblique. These are going to be intorters as well. Muscles that have inferior are going to be extorters. All right. I hope that that proves useful to you while you're studying, makes things a little bit easier for you. The last topic that we'll cover here is the somatic motor innervation of these muscles. The oculomotor nerve does the bulk of the heavy lifting here, and it innervates 5 out of our 7 extraocular muscles. It's going to enter into the orbit through the superior orbital fissure, and then it's going to split into a superior and an inferior division. That superior division is going to head up to innervate the superior rectus and the levator palpebrae superioris. The inferior then is going to go to the inferior and medial rectus, as well as hit up that inferior oblique muscle. The other 2 nerves here also enter through the superior orbital fissure. These are going to be the trochlear nerve, which is named for that little fascial sling here that the superior oblique muscle goes through. So the trochlear nerve heads to the superior oblique, which then heads up to the trochlea. And the last nerve here is going to be the abducens nerve, which is going to go directly to the lateral rectus. So the lateral rectus, remember, is going to abduct the eye, so the abducens nerve is specifically for that. All right, I know this has been kind of a long slog, so I really appreciate you hanging in there this far with me. Here is a practice question to round out the video. All right, the correct answer here is B, abduction and depression. An injury to the trochlear nerve would affect innervation to the superior oblique muscle. So our superior oblique. And our superior oblique muscle is an abductor, a depressor, and an intortor. And that is going to bring us to the end. Thanks for watching.